There is a huge need to help those who struggle with mental health in our community. That's why the staff at the Community Behavioral Health Center is making more services available. We sat down with psychologist Rick Adams to talk about their recent 12-bed expansion and plans for the future. Tell us about your center.
Sure. This is a inpatient psychiatric hospital, really, that's associated with Community Regional Medical Center. We currently have 73 beds. It's all for adults. And I should mention the 73 is the recent expansion over 61, which we've had since inception. So it's adults with a severe or serious mental illness.
When did you get those 12 beds, and how did that help your hospital?
Okay, the 12 beds opened 4 weeks ago, and interestingly, they're pretty close to full all the time now, so it really did bring in a lot more of the people that need service. So it helped our hospital, but a lot of what it does is two things come to mind immediately. Folks that are in crisis end up in emergency departments around the area and also at crisis centers. If we don't have beds, then it takes longer for them to get a place for treatment, and also they're going to linger in an environment that isn't providing treatment, that's just holding them. There is actual aerial data that I've been to conferences and it's discussed how many psychiatric beds are needed per 100,000 population, and Fresno is severely low compared to basically national agencies' numbers, but even compared to other large metropolitan areas in California.
So let's talk about the good news here, which is you guys are expanding, and expanding pretty largely here, right?
Yes, we just opened the 12 beds that I mentioned and are filling them quickly within a month. And in addition to that, we are beginning the planning, and we're meeting every week to put together an actual addition that's larger, could eventually have room for up to 36 inpatient psychiatric beds. But initially what we're looking at is opening 18 beds. Time frame, as I understand, is about 2 years.
Thank you very much for your time, Doctor.